So Memory Palace is the oldest documented memory technique in history. So it actually dates back to the Romans and the Greeks. It's in the history books that they use this. So Memory Palace means you pick locations or places in the palace, your home or your neighborhood or your city, and then you use that as a landmark to remember the information. So you have to use this visualization and association, but then you link it to your landmark.
Hello, this is Anthony Effinger. I'm the host of the Think Neuro podcast from Pacific Neuroscience Institute. And today I'm talking with Dr. Karen Miller. She's the Senior Director of the Brain Wellness and Lifestyle program here. Thanks for joining us.
Thank you for having me.
So tell us a little bit about your background first.
Sure. So by training, I am a clinical neuropsychologist, which means that not only have I specialized in clinical psychology, but I also have a background in understanding neurology and neuroscience as it pertains to psychology, which is really the focus of assessment of the brain. So that means looking at things like memory, language, visual spatial skills, intellectual ability, sometimes personality, mood, and how that might be impacting your everyday life. So for some people, they might have attention issues, they might have memory issues, they might be recovering from a traumatic brain injury, or they might be aging and at risk for dementia.
Okay. So that's the difference between a psychologist and a...
Sure. So a licensed clinical psychologist specializes in psychology with usually an emphasis in, let's say, therapy or maybe research or teaching, which we do all that as well. And then we add another 2 years on top of our training to specialize in assessment. And the assessment is really looking at data and what it means for your brain function.
Are you seeing patients the way a psychologist would, a
Absolutely.
clinical psychologist would? Are you sitting down and talking with them and doing all
Yes.
those things?
Exactly. So part of our role isn't what we would call an intake or a first meeting where we'd gather all their background information. So one thing that's really critical is to think about how data has to be tailored very specifically to the individual, right? So we might have these sets of data that look at a cohort, an overall age group, or that sort of thing, but we really want to know how many years of education have you had? How many languages do you speak? We want to know, what did you specialize in and for your career, or what was easy in school, what was difficult, so that we can understand maybe where your what we call your baseline functioning was, and then have there been any changes due to any event or due to aging.
I was going to say, this must be particularly important for aging. When you're talking about
Exactly.
baseline, you're saying, where were you and where are you going?
Exactly. And so we see people actually of all ages, because people even in their 40s are thinking about aging. And that has a lot to do with the fact that they're seeing their parents age or they've already lost their parents, right? So assessment pertains to whether you're age 5 or 95, honestly, 105. But in our field here at Pacific Neuroscience, we're really looking at a large lifespan of 40 plus year olds who are thinking about what's going on with my brain health and what might happen next, and how can I prevent any negative changes. And for many of our folks, they're actually interested in what we call brain health optimization. And that's really like, how do I keep everything I have and maybe even improve?
So somebody comes in their 40s here and says,
Yes.
hey, this is what's on my mind. How can you help me?
Yes.
Okay. That makes a lot
Or
of
50s, 60s.
Sure.
Yeah.
But even
Even as young as 40s.
as young as the 40s.
Believe it or
Somebody
not, we
who's-
have a couple 30-year-olds.
who are like, and what's
Yes.
their concern? They're like,
They
I'm
actually have a
30.
very strong family history of Alzheimer's disease.
Okay.
And so they're thinking, wow, this happened to my parent at an early age. And so I want to know, as a 32-year-old, what could I start doing to make sure I have the best possible trajectory?
That makes a ton of sense.
Yeah.
Right. It also makes sense in the sense that, Peter Attia,
Yes.
what's his book?
Outlive.
Strategies and tactics for improving your,
Yes, longevity.
and getting the most, what does he call
Right.
it? Good years.
Yes, we
Yeah.
want to think about living longer better,
Yeah.
not just living a long life.
Yeah.
Right.
Exactly.
We want to have a very fruitful life.
Yeah.
So when we think about longevity, we think about vitality, right? We want to be vital in our later years, not just existing.
Yeah.
Right.
Here, here.
Yeah.
Um, which of those measures show, say, the deterioration over
Sure.
time best, or what are
Yes.
some that come to mind in that?
Absolutely. So when we look at somebody, let's say in their 40s or 50s, and everything should be normal, if in fact they do any type of assessment or they're reporting some mild changes, what we notice first is the mildest changes in either memory or in language.
Mm,
And when I say language, it's usually word finding difficulties. Now, it's very normal to have that tip of the tongue. For anyone over 40, they're going to be like, oh, I'm looking for that word I want to use. But if that becomes more pervasive and they actually have more word finding difficulties, then that should be normal for their age. That can be an early sign. The other early sign is there are very specific memory tests we give. And if they perform below their peers, their same age and education, on those memory tests in their 40s or 50s, that's a warning sign that things could get worse.
I'm glad to hear you say that about the word finding, that
Yes,
it's normal.
it is normal.
Yeah, we'll see how this podcast goes, but I think I'm in the normal band.
You're well within the
Okay,
normal
all
band,
right.
Anthony.
Now, talk about that second piece, about comparison to peers.
Yes.
Say more about that.
Sure. So when we think about how we have performed across our lifespan, we want to think about what was easy for you, let's say when you were in school. So if you, I imagine, were a great writer and very good at words. And so if in fact that was your strength, we hope that would remain your strength as you age into your 40s, 50s, 60s, and beyond. If for some reason you personally start having a lot of difficulties with language, which happens to be your strength, your niche, then we would be more concerned. But if you told me, and I'm not saying this because I don't know this about you, but if you said, I never cared for math, then I wouldn't worry about it so much if I gave you a math test because you'd say, that was never my favorite subject or I was never strong in that.
I see.
Right? Now, like you might have a family member who's superb in math, right? And as they age, you would expect them to remain strong in math. And so if in fact there was a change in their math skills, then we'd be concerned. So over my period of my career, I've worked a lot with engineers, for example. And engineers typically have very strong visual spatial skills and math skills. Not always, but typically. And if at the first time at 60, 65, they say, I can no longer do simple math really quickly, they're concerned. And then I'm concerned as a clinical neuropsychologist because I say to myself, maybe there's a change going on because this should have been continued to be easy for you.
Do you work with a lot of engineers? You have worked with a lot of engineers because...
So previously I was at UCLA Medical School and I had a role there as a faculty and professor. And so we saw people of all walks of life, right? But it was interesting because sometimes I would say individuals who have a lot of education are the first ones to notice that there might be a cognitive change. So I've seen a lot of engineers over my life and a lot of lawyers because those people tend to really value their acumen, right? Their cognitive skills. But here at Pacific Neuroscience, I feel very fortunate. I meet a lot of executives, right? Because executives sort of come into their own in their 50s and 60s. They want to remain on top.
Sure.
Right. And so we see a lot of executives, and they're fascinating people because they tend to be good at everything. So they've done well in school in every subject. And they're really not only good at language and visual spatial math, but they're really good at what we call frontal lobe functioning. Right here, the frontal lobes, executive skills. They're an executive. So they're good at managing a lot of information. And so part of the testing that we might do actually also looks at how are they doing in continuing to manage that volume of information. So when we design intervention, cognitive training, we include not only language and memory and visual spatial, but it's very important to include that frontal lobe functioning or the executive skills.
Sure.
Because we all need executive skills, right? Like assuming that you drive, Anthony, and that you balance, your accounts and that you manage your bills and you manage your life, you manage your job, your computer, your calendar, that's all executive skills.
Yeah, I've definitely known people who are really good at that and people who are not so good at that.
Right. Yes.
Yeah. So talk about the interventions. When you do discover the slippage,
yes,
what do we do?
Yeah. Well, in regards to the slippage, and I like that word, as we do the intake, it could be an hour, it could be 90 minutes, it might be 2 hours because we actually include the family members too if they want. So people will come alone or people will come with their spouse or partner, and many people come with their whole family, believe it or not. So we listen to their story and I take notes and I try to really think about what's changing, what's their strengths, what are their concerns. And then based on the information that they're sharing, we begin to design a very specific intervention treatment program for them. So in our brain wellness program, we focus on what's called lifestyle factors. So for some people, it might be additional exercise that needs to be built into their schedule. For other people, it might be really an emphasis on nutrition. And they might want to work with one of our dietitian nutrition specialists so that they can fine tune what is the right foods for them for optimal brain functioning.
Is that different person to person?
It is.
Yeah.
Absolutely. And we also design a cognitive training program for them. And we have a lot of different types of cognitive training programs that I can talk to you about in a minute. But each person, they might need to work on all these areas, or they might need to work on one or two of the areas. So what we'll do is really try to hone in on where they should put their time, effort, and resources, right? Because people only have so much time in the day. And a lot of times people are overwhelmed at first. So we try to think about, I try to put in order the importance of for them to do first. And so perhaps, let's say they already love golf or they love tennis. This is very common. Then we talk about, well, why don't we also add in a personal trainer twice a week, right? And so then they have another source of exercise in addition to their golf or tennis.
So they're not just doing the same thing.
Exactly.
Something their brain is probably reflex.
Yeah, well, and they enjoy golf or tennis, which is great.
Yeah, sure.
But they might need a little more added in. Or for some people, they say, I eat pretty healthy, but then as you dig in a little deeper, they actually do need a little more help with their nutrition choices.
Yeah.
And so they'll work with one of our
according to Atio, nobody's getting enough protein. Very few of us are.
That's very true.
Are you on board with that idea?
Yes. I mean, protein and going into ketosis, that's one of our nutritionist specialists, is specialty.
Ketosis is, just for
so when you're
burning
more than you're taking in and you're burning the fat and such. So it has to do with ketones and protein levels. And that's not my specialty. I will admit that. But that's the idea. That's an idea like that. They might be eating a lot of vegetables, but they might not be having enough protein.
Yeah.
And so that's a really great time to intervene with a nutritionist.
Certainly. Yeah. I mean, I hear that all the time.
Yeah.
From people. How many people who come in for an evaluation like this are like the worried well?
Oh, I love that question. So I like to think of my clients in 3 groups. 1/3 is the worried well, that they're really aiming to optimize their brain functioning because they want to stay on top of their world or they've seen a parent age or decline. And so that 1/3 that's the worried well is really looking to optimize. The other 1/3 actually already have been diagnosed with mild cognitive impairment. And so to really clarify what mild cognitive impairment is they've gone through some type of formal testing, most likely brain scans or neuropsychological testing, and at least one area of their functioning is below their peers. And so what that typically looks like is their memory or their language skills are lower functioning than their same people their same age and education. And in that case, they're in the risk category. And that risk category means that they really have to get to work right away in order to decrease their risk for dementia.
Okay.
So when we have individuals in that group, right, we are really buckled down. We're like, here are every step you've got to do. And we give them a lot of coaching to try to be able to implement everything.
Nutrition, exercise, lifestyle.
Yes, stress reduction, cognitive training, novel stimulation, social support, all of these things, because our goal is to help them to not go into dementia. And so that is a really important focus at the Brain Health Center, our medical clinic. with Dr. David Merrill and with our Lifestyle Brain Wellness program, because we have these identified individuals and we know that we really have between 5 to 10 years to make a difference.
Once you see this initial bit of deterioration,
Correct.
5 or 10 years is the
5
window?
to 10 years is the window in which they're at risk for converting to dementia, but not all convert.
Okay. That's encouraging.
Exactly.
Yeah.
And that's why we're really passionate about this particular group. I mean, we love the Worried Well because they're ahead of the game.
Certainly. Okay.
Right?
So they're
great.
not a burden to you. You like
Oh,
seeing them.
no, they're wonderful
You're
because
heading
they're
off-
thinking ahead of time.
Yeah.
You know, it's like a high schooler planning to go to college. Like, oh, yeah, I'm planning to
Early admission, sort of.
Early admission.
Yeah.
Exactly.
Okay,
They
great.
have the best.
So come on down. Okay.
Exactly. So the Worried Well, or those who have a risk due to family history, we're very invested in helping them because we have lots of time on our hands to help them and they to help themselves. Now, those with mild cognitive impairment, this is serious business. We really try to impart the message that we want to do all of these things comprehensively so that your risk for dementia is lower rather than higher. And then we, of course, have a soft spot for those who have already been diagnosed with dementia, like Alzheimer's disease or something else. And the goal there, in some cases, people do get better. So there's a small percentage of people who actually show improvement if they tackle and take on all of these lifestyle interventions.
A small percentage.
Very small percentage, but it is possible.
What are we talking?
We don't have exact numbers.
Yeah, that's a toughie.
But we do partner, like I said, with Dr. David Merrill and Dr. Dale Bredesen, and we do see some people improve overall. I'll share an exciting example. So we had one individual who was a physician, and his doctor said, you're at high risk for Alzheimer's disease. The disease is there in the pathology.
In the pathology?
In the brain. They could see it.
Meaning you saw it on imaging or
Yes.
you can see it?
Yes.
Okay.
And so he decided to take a pause from his career and he focused on all these lifestyle interventions. And a year and a half later, he was significantly better. So there is a caveat that some people do not yet have dementia, but they've been diagnosed with Alzheimer's disease. And that means the disease is showing up in their biomarkers. So they might be able to see it in their blood work, or they might be able to see it in their brain imaging. So in this particular case, we had a physician whose neurologist told him, you have Alzheimer's disease. Now he's very high functioning. Right. So he thought,
How old was he?
He was in his late 60s.
Okay.
He spends all this time healing others, right? He's a physician. So he's very dedicated to research and to his clinical work. And so he thought, I have spent my whole life helping others. Why not help myself? So he took everything that not only my team had to say, but also Dr. Merrill's team, and really put his all into it. And he actually showed improvement in his overall functioning. And so that's an example. We don't always have examples like that. So I'm not saying that.
I mean, it's a degenerative disease, right?
But he did show improvement across his testing. So there is hope for each category. Well, we're talking about the Worried Well, the mild cognitive impairment, or those with dementia. But most people with dementia, our goal is to slow it down. So I'm a very realistic type person. So if someone comes in and they've already been diagnosed with mild dementia, we're hoping to keep it at that mild level. So a lot of our interventions that we would apply to those other two groups, we apply to them as well. Now, we are very realistic in that, let's say we've designed a cognitive training program. If someone already has mild dementia, we're going to have to go at a slower pace, right? We're going to have to take more time and take longer to teach them the same information, but it could potentially slow the disease.
Can you give me an example of one of the cognitive exercises that somebody might do who's in this mild dementia category?
So we teach actually very similar exercises across the groups. It's just the level or the intensity in which we teach them. So one example is we're really focusing on how can you encode new information better, all right? So when we want to encode new information, we have to create a way to enhance our attention, our ability to pay attention and to potentially visualize that information, right? And so if we want to do that, we have to create maybe some type of association or visualization or some way to link it to information so we'll be able to retrieve it easier.
So sort of mnemonic devices,
Could be mnemonic.
writ large, kind of.
Exactly. It could be a way of visualizing something.
Yeah.
So I'll give you a funny example. So the way I challenge myself all the time, because I figure I should not just preach this and teach this, I should do it.
Yeah.
So I have a son who's in college, and one of my goals is to memorize the name of his professors every single quarter. Okay? And so he has a professor who's named Professor Long, and he happens to be from the UK. So Professor Long, like Dr. Miller, that's a pretty generic name, Long. So, but since he's a Brit, I picture him as a sailor, okay? Because, you know, the UK is surrounded by water. And he's an older gentleman. I've seen a picture of him. So I picture him as Long John Silver's because that's like, you know, a fast food chain from my childhood, right? And so by picturing that and laughing and thinking about this British guy who's teaching mathematics at the college level, then I can say to my son, hey, you know, how's class with Professor Long?
There you go.
Yeah.
Yeah. So there's an example.
Yeah.
Some things we should all try to do
daily.
Daily,
we should challenge ourselves to learn something new and for us to try to use this visualization or association technique.
Visualization and, okay.
Yes.
All right. I'm going to make a note of that. I once memorized the entire periodic table.
Oh, yes.
By using a memory palace.
Oh, Memory Palace is awesome.
You want to describe what one of those is?
Yeah. So, okay, Memory Palace is actually the sophisticated version of what I'm talking about. So Memory Palace requires you to have this technique that I just talked about down pat, and then you apply it to actually locations. So Memory Palace is the oldest documented memory technique in history. So it actually dates back to the Romans and the Greeks. It's in the history books that they use this. So Memory Palace means you pick locations or places in the palace, your home or your neighborhood or your city, and then you use that as a landmark to remember the information. So you have to use this visualization and association, but then you link it to your landmark.
Because isn't our brain better at remembering locations than...
Well, what it does is it's a location, but it is a retrieval cue.
Okay.
Okay. So you and I are sitting in a large conference room, and if this was my home, I would pick the large TV, the elevator. I'd pick this cute little plant here. Those would be 3 of the landmarks in the room.
And you would assign...
Yes.
What you're trying to memorize?
Correct. So I'll give you an example. Let's say after work today, I'm driving home and I think to myself, oh, my friend Susan's birthday, who lives in Canada, is coming up. I need to buy her a card. I need to send her a present. And because it's been a particularly rough year, I'm also going to order her flowers. Okay. So what I'm going to do is I'm going to picture Susan in the elevator. The elevator opens and she reads my card and she's so happy she got a card from Karen. Okay. And then I'm going to picture that there is literally a picture of her present on the TV.
Okay.
All right. And then it's an obvious one, but this cute little plant, I would put her flowers next to it because she actually loves plants even better than flowers. So I might send her a plant. So I'm going to remember card for Susan because she's in the elevator. I'm going to remember present, which is now pictured on the TV here in this room. And I'm going to remember flowers next to the plant. And so as I'm driving home, I don't write any of this down, but I take the mental time to place those associations in those landmarks so that when I do finally get home, then I can either write myself a note or immediately order all 3.
There you go. Yeah. Okay. And that's an example, again, of things we should be maybe trying to challenge ourselves with every day.
Every day.
Yeah.
You want me to give you a personal example?
Please.
With you?
Yeah. Okay.
Okay. So you and I have been talking over the years, and we both have sons. So you told me that your son studies fluid mechanics. That's really hard to memorize.
Okay, right. So, it's kind of abstract.
It's abstract.
Yeah.
Fluid mechanics. So how am I going to remember that Anthony's son studies fluid mechanics? I'm going to picture you standing next to your son. My guess is he's taller than you. And he's pouring fluid over you, right? And like maybe like some like oil or something really
Yeah.
greasy, like not just a water,
Sure.
ice bucket challenge.
Yeah.
So then when I see you, I see a tall young man standing next to you, and I see him pouring fluid on his dad. And then I'm going to remember he said it's fluid mechanics.
And you also, I noticed, remember his name, which is
Okay.
impressive to me because I can never remember.
Can I tell you how I did that?
Yes, please.
Okay. I didn't know if you wanted me to tell you that.
No, yeah.
So your name is Anthony and your son's name is Christopher. And so I thought, oh, what do Anthony and Christopher have in common? But what they have in common is they're both saints.
Yes, I had a feeling you were going to say that.
Yeah. So you are a wonderful individual. So I know you're no saint, but I think to myself, Saint Anthony and Saint Christopher. And when I say that, I actually picture those little medallions,
Yeah.
and like some TV shows like Law and Order, they always are wearing their little saint medallions, because that's not part of my culture, but I think of particularly Law and Order for some
Sure.
reason. They're always wearing those little saint medallions, some of the cops or lawyers or whatever. And so I picture Saint Anthony and Saint Christopher, and I picture those medallion necklaces on you guys.
Perfect.
And then the fluid.
I was wondering how you did it because we talk every few months or so.
Yes.
And you are always just right on point.
And the first time you told me your son's name, I remembered it. I went home, I told my son your son's name. And then it was a couple months before you and I connected again, and I forgot it. So I asked you again. I said, Karen, double down and remember Christopher even better, which I have.
Oh, so
and now I won't forget it.
You're a great example to all of us. So I'm going to start trying to.
Every day.
Yeah.
You learn
Not
something
just
new.
to remember things like, doing nice things for a friend,
Right.
but for your brain.
For your brain.
Yeah.
I mean, yes, it's wonderful that I can remember my son's professors' names. I know all of them.
Yeah.
per
That's
quarter.
a lovely, yeah. And so.
And I have a great conversation with him because
yeah.
of it.
And he knows you're interested in his life.
Yeah. Whereas my
Yeah.
husband's like, you go to college? ? No. He knows. He knows he goes to college, but he can't remember any of them, right? Because I'm giving him homework, but he doesn't remember. But I'm actually doing it selfishly to keep my brain sharp.
Okay, that's really interesting.
Do you know what I mean?
That's what we all got to
Of
start
course,
doing.
I love
Yeah.
my son. I want
Yeah.
to know who Professor Long is. I looked up his picture and everything. But I also am thinking, this is how I do my version of cognitive training daily, right?
Yeah, I like how you're living your.
Got to try your best.
Yeah, you're.
And it's good for your socialization, your
Yeah,
people
certainly.
skills, your connection,
Yeah.
I mean, I even talk to strangers, and I will just challenge myself in the moment to do it.
To talk to strangers or to remember things about the strangers.
Both.
Yeah,
To
I've heard that about talking to strangers. I do that too.
It's stimulating.
It's stimulating.
And
Yeah.
you learn something.
Yes.
But then also you can actually do like a mini brain boot camp in the moment,
Oh, I love that.
because you are doing like a mini cognitive training lesson. So the best one is your waiter or your waitress. When you're at a restaurant, because you have a whole hour with them, so you ask them their name and then you try to create an association. And the good news, and this is important for our listeners, is you don't have to hold on to it the whole time. Like, I want to remember Christopher's name,
Yeah.
your son.
This is it.
I'm holding on to it. But in a situation with a waiter, if you even just hold on to it for the hour, you've done your homework and you can dump it. You can let it go. Now, if you see that waiter again and you go to a restaurant again and again, it's really great to be able to remember that.
Certainly. I mean,
right?
you're gonna. Yeah, they're gonna love you. I
Like
mean,
one of my favorite waiters' names is Norman, and I go to this certain place for breakfast. And I don't go to Norm's for breakfast, but Norm's was famous for breakfast. So I just think Norman is not at Norm's, but he's at Karen
Perfect.
Miller's favorite breakfast place.
Yeah.
And now I've known Norman 20 years and he loves me. And of course, I'm probably the only person who walks into the whole restaurant that says, "Hi, Norman."
Yeah.
You know, and then he gives me blueberries, which is good for my brain.
He
He does, for
went
real.
all the way around.
I know.
So
he always gives me berries.
It's funny you mentioned restaurants. And one last thing, I'm always amazed when a waiter can remember like an order
Oh, yes.
for the whole table
Yes.
of 6 people.
I'll tell you how they do that.
Yeah, please.
Okay, so when you take an order, you're not actually using your short-term or long-term memory. You're using what's called working memory. So working memory is that you have to listen very carefully in the moment and take it in, almost like a phone number. So when they take like 5 of you's orders, each order is like a number in a phone number. And so they're just remembering it long enough to dump it at the kitchen. And so it's really quick memory. So they don't have to hold on to it. So it's a little bit different. So to give you an idea, first of all, you have to be alert in life.
Certainly.
That's the first step.
Yeah, you got
to
to pay
memory.
attention.
Well, you got to be awake.
Okay.
Right?
Yeah.
Okay, so when you're in class and your professor's talking and you're asleep,
Yeah.
no memory. So first you have to be awake and alert. The second piece is you have to pay attention. The third piece is the working memory. You have to create this loop, like as if you're listening to a phone number.
A loop.
A loop. So like if I rattle off my phone number to you, all you have to do, Anthony, is listen to it long enough to write it down. You
Okay,
don't
right,
have to memorize my phone
right,
number.
Right.
So the waiter is listening to your order just like a phone number.
They know that. What I mean.
Yes.
Okay.
A good one.
Okay.
A good one. But they're not going to remember your order an hour later.
Of course.
They don't need to.
Right.
They've dumped it already.
And they probably have a working memory that is sort of in shape.
Correct.
That, right?
Because it's part of their job.
Yeah.
I love that. It's in shape.
Probably, right. It's been exercised
They're a loop
thousands
expert.
of times.
They're looping that information.
So when you say looping, are they repeating it over and over, or what do they do? No.
No, they're really, it's just like that. It's that intense attention for the moment.
Intense attention for the moment.
Yeah.
Working memory.
Yeah.
Okay.
A really good example is if you go to a new doctor's office and you go up to the front desk and they say, fill out all this paperwork. And they say, oh, I'd really like to use your restroom. And they say, oh, our restroom is out the hallway. Walk 5 doors down, then take a left, and then a quick right is the mints.
Then the code is.
And the code is. You only remember that till you get to the bathroom.
Yeah. Okay.
And then when you go back, you never bother again
Okay.
to hold
okay.
on to that. That's the waiter's order.
Yeah. Yeah.
Does that make sense?
Oh yeah. No. Totally.
The next type of memory is what we call short-term memory. And the goal in short-term memory is we're paying attention and we're deciding whether or not we're going to store it for long-term memory. So if you and I only met once, which is not true, but if we only met once and you wanted to talk about Christopher and I wanted to talk about my son, Jack, you might remember Jack for that first 20 minutes. But if you thought, I'll never see that Dr. Miller again, you go home and you dump my name, you dump Jack's name, you dump that I come from Pacific Neuroscience Institute. You don't need to remember that anymore. So that was short-term memory because you only engaged for 20 minutes with me.
Okay. Okay.
But if you went home and you thought, well, I'll be back again. Whew, I have to put up with this group again next year. I'm going to remember at least Karen Miller's name.
Yeah.
Then you have to move that into long-term memory.
Okay. Okay.
Right?
Yeah. Yeah.
So,
All right.
so it's all about from alert to attention to working memory, short-term memory, long-term memory.
All right. And we should sort of, train them all, maybe.
For sure.
Yeah.
We actually
it's like
should.
having leg day and.
Yes. We need a whole brain workout. And that's just memory.
Okay.
We haven't even talked about language.
What do we call them? Mini brain boot camps?
Yeah. Mini
All right.
brain boot
That's
camp.
what we're going to do.
Yeah. When you're in the elevator, when you're driving in your car, when you're out to dinner with your family, you just challenge yourself to remember new information.
Okay. We'll do.
Yeah. Like whenever I move to a new building, right, for a practice or something, I try to remember a certain number of different providers' names.
Good one. Yeah.
You know?
So there's lots of opportunity. I mean,
Oh,
and
yeah.
it's fun.
Exactly. Like I came from UCLA where I had thousands of colleagues, right, that I had memorized over 30 years. And then I came to Pacific Neuroscience and I had at least an immediate 100 new colleagues.
So
I had to work my way through systematically to try to memorize as many of those colleagues' names as possible.
yeah. Well, this is terrific. Dr. Miller, it's always a pleasure. This is a great discussion. This was a
Thank
delight.
you, Anthony.
Thank
It's
you
always
very much.
good to be with you.